All set? All set? Okay. Well, good afternoon, everyone, and welcome to our weekly COVID briefing. And just want to welcome everybody. And just to remind everybody, you know, January could be a tough month, and the city manager is going to go over that the numbers a little bit later. But please wash your hands, socially distance from one another, as we ask you to do. It is so important. Try to stay in your bubble of people who you normally hang around with in your families, and because this, as Dr. Hirsch was saying, this could be by the end of January we could hit the peak, even though there might be some positive numbers too at the same time. We'll know more as we get to the end of January. So please practice socially distance again, to wash your hand, practice good hygiene. And it affects everyone. You look, the city manager has the stats, but you know, under 50 years old, 63% of the people have COVID under 63. Under 50 years old, 63% in Massachusetts. And 19 and under represents 14%, almost 2,400 people. So it affects everyone out there. We do have some good news. I think the vaccine has begun to be distributed here to first responders, police, and fire. I want to thank the manager, and he was planning on this even when he had COVID-19 and wasn't feeling well, and making sure this goes off. And I want to thank Dr. Hirsch and the Public Health Department, the Emergency Management Department, for everything they've done to get this up and running. I think the governor was here on Tuesday with the lieutenant governor, and he did the tour, and I thought it was very impressive. Again, I want to thank all the volunteers there who were there. They did a great job. They made Worcester really good, and the vaccinations are going as planned, if not better. So, and I think Dr. Hirsch, the manager, will speak more about that. And the people who in the next phases, just remember this is an incredibly fluid situation that involves both the federal government, the state, and of course our local public health department. On every level of government, we're working with all our partners to make sure that everybody gets vaccinated in a timely manner. And when the governor was speaking the other day, he said he always gets 2 days' notice, and it's hard to plan, but hopefully that will change over in the next coming days. I know that many people have questions about when and where individuals can get vaccinated. At present, our team is working with the State Department of Public Health on acquiring vaccines in the distribution plan. I cannot stress enough that this is a developing situation, so I'm urging the public to stay informed and keep an eye on legitimate media outlets, as well as the state and city websites. This is going to be most reliable sources, and I know the manager is going to speak more about that when he's up at the microphone. Some state news: the daily COVID dashboard is now in an interactive format, enabling users to focus on particular metrics, timeframes, and more. The interactive dashboard and weekly public health report will be published Thursdays beginning at 5 p.m. tonight, so if people want to do that. It's also it can be found by searching mass.gov and COVID-19 response reporting. The state has also established a new vaccination dashboard, and the vaccinated dashboard will also be posting on Thursdays at 5 p.m. It includes doses of vaccine shipped and administered, and people vaccinated, the vaccine distribution by county, age, race, ethnicity breakdowns. And you go to https://www.mass.gov/info-details/stop-COVID-19 vaccine graphics. Statewide numbers. Yesterday, the death toll from confirmed coronavirus cases in Massachusetts rose by 86 to over 13,082 deaths. The number of confirmed cases climbed by 5,278, bringing the total in Massachusetts to 427,752. And also, as of today, we currently have over 90,000 people who have COVID-19 in Massachusetts. So take it seriously again, and keep in practice the 3 W's. And nationally, we have 22.7 million cases of COVID and over 380,000 deaths since the start of the pandemic. And just remind people about rental assistance. I just want to remind folks that the City of Worcester has contracted with 5 local housing agencies to offer rental assistance programs. $1.9 million in rental assistance is available to residents of Worcester. I want to thank the manager and his team for providing that. And the partnering agencies include Central Mass Housing Alliance, Friendly House Inc., Open Sky, Community Services, Worcester Community Action Council, and Worcester Community Housing Services. These are federal block grant dollars that the city has directed to rental assistance. And we know that the renters and the landlords are suffering right now because of the pandemic. So if you need to apply, you can contact my office of the city government for more details, or you can go to www.worcesterma.gov/coronavirus/assistance. And as I mentioned the last time, unfortunately, scams do happen, and they're happening with the vaccine. So Attorney General Maura Healey is providing warnings about vaccine scams. Already her office is warning of email and phone scams, asking not to forward any of these scams or repeat them. The Attorney General's office is telling residents that you cannot pay to put your name on the list to get the vaccine or to get into a vaccine clinical trial. Information how to access the vaccine will be widely disseminated by the Department of Public Health when the vaccine becomes available to the general public. Massachusetts residents will not have to pay out of pocket for the vaccine. And again, for more accurate information, please refer to our city's website, the state's COVID page, or the CDC's website. Testing sites, UMass testing is at the Mercantile Center for next week. There will be no testing on Monday next week due to Dr. Martin Luther King Jr. Day. However, on Tuesday, January 19th, 10:30 to 3 o'clock at Mercantile Center, and on Thursday, January 21st, from 10:30 to 3 p.m. And this is a stat I used to give back a few months ago, but we still make contact with our seniors on a regular basis. This week, we made 490 senior calls this week and delivered 5,721 meals. So with that, again, please practice good hygiene, wear your mask, and wear your mask. And we will turn this over to the manager. Mr. Manager?
Thank you, Mr. Mayor. As of today, we have a total since the beginning of the pandemic of 17,129 confirmed positive cases of coronavirus here in the city of Worcester. That's an increase of 1,219 over last week's number. We're looking at whether or not that seems to be close to the same number as last week, even though the number is 1,376 for last week. Last week had an extra day in it when we reported out because of the holiday. So we're looking at, are we seeing a period of time where we're kind of plateauing and flattening out? We don't quite know the answer to that. We'll look at next week's numbers, but hopefully that's what we're seeing, and not some impact of maybe less testing that's available in the community. So we'll be looking to that and hopefully can report on that next week. In the towns, the town of Shrewsbury had another 212 cases in the last week, bringing their total for the pandemic to 2,008. The town of Holden had another 105 cases, bringing their total to 965. Town of Grafton, another 81 cases, bringing their total to 702. And the town of Leicester, 62 additional cases, bringing their total to 700. The combined UMass Memorial St. Vincent numbers, inpatients, 244, that's a decline of 24 from last week. COVID positive ICU patients, 60 between the two health systems. That's an increase of 1 from last week. COVID deaths, 542. That's an increase of 33 from last week. And then COVID positive employees in health systems, 1,553. That's an increase of 104 from last week. The Worcester specific deaths, again, making the distinction between the UMass Memorial and the St. Vincent numbers, which are inclusive of Worcester, but maybe folks from the towns outside of Worcester, but the Worcester specific. That's unfortunately, we lost another 11 Worcester residents since last week, bringing the total to 353 Worcester residents that have succumbed to the coronavirus since the beginning of the pandemic. Currently, there are 53 patients at the DCU Field Hospital. The city family, the city workforce, we have 35 active cases amongst city employees. They are isolating. We have 11 other city employees who are in quarantined because of close contact. So that's a total of 46 City of Worcester employees who are out of work, either isolating or quarantining. Vaccinations. I think when we opened the vaccination site on Monday morning, I paraphrased Winston Churchill to say that it wasn't the end of the beginning, but the beginning of the end. And it was, I think, the first day we felt as a city like we were finally playing offense against this disease. We've all been doing what we can to wear the masks, do the social distancing, limiting the crowds, washing the hands, the hygiene protocols, but that really is playing defense, trying to avoid the virus. By inoculating folks, that really is us kind of going on the offense and trying to really slow and stop the spread of the virus in our community. The emergency dispensing sites were opened at the senior center, operating on Monday, Tuesday, and Wednesday of this week. The priority category of folks we were responsible for at that location were police, fire, EMTs, dispatchers, and college and campus police. It was for the city of Worcester and for our 6 alliance towns, which include Shrewsbury, Millbury, Leicester, Holden, Grafton, and West Boylston. Those facilities operated from 8 a.m. to 6 p.m. They have the capacity to do 320 vaccines a day. I'm happy to say that at the end of the 3 days this week, we inoculated 754 individuals in those categories. I think we'll be visiting with those folks again in 3 weeks. This is the Moderna vaccine, so they're going to come back, I should say 4 weeks. They're going to come back in 28 days for their booster shot. I want to thank Chief Lavoie and Chief Sergeant, our fire chief and police chief, respectively, for taking the first vaccines and really showing the leadership about how important it is for all of the men and women of both departments to get the vaccine. I also want to really acknowledge, and I know the mayor touched on this, the Herculean efforts of our emergency management personnel and our public health staff who really have worked 7 days a week, extraordinarily long hours to get these EDS site up and running, to do the training, the planning, the logistics, the coordination, the communication, the reporting, all the things that go into making this possible. And the goal is to take that number of 320, 3 days a week, and expand it. We were starting off trying to work the kinks out, making sure that we figured out how, what the rhythm was going to be, how many we could do, how it would all work out, and the goal is to take those modest numbers and try to grow those each week. As the funnel expands, as we move through the different steps of each phase, there are going to be more and more people who are eligible for the vaccine. If you think about the categories of folks that are eligible now, we're talking hundreds and thousands of folks. Ultimately, we're going to be talking about thousands and tens of thousands of folks who fall into the upcoming categories of folks in subsequent phases, and we need to expand that opportunity to do that. And Dr. Hirsch and Dr. Castile and Chancellor Collins and all the folks at the medical school have been amazing resources in training folks. So I think we're close to 300 individuals who have been trained on being inoculators. so that as we look to expand the number of folks and the number of sites to do these vaccinations, we have the staff to do that. We're also looking at creating mobile vaccination units. Eligible in this category, this particular phase, are our homeless community. So we're looking at expanding the opportunities to send folks out to the shelters and vaccinate the staff and the homeless who are often living in congregate settings, which we know can be a lot more vulnerable to the spread of the coronavirus. And so it's important that they get this vaccine as quickly as we can get it to them. And that all really is reliant on these additional volunteers that have come forth. And, you know, it's one of the great reasons that we're so proud to have the medical school here in our community. Not only do they provide first-class medical education to lots of talented folks, but they give back to the community and they help us in times of need, such as dealing with the pandemic. So I do want to thank the Chancellor and all the team at UMass. Just to give you a little bit of numbers, specific numbers around who we vaccinated this week. We have done about 45.4% of the City of Worcester employees who are eligible in this first wave. So again, it's our fire, our police, and our communication. We did 21 of our dispatchers and our emergency call takers out of a total of 56 employees. That represents 37.5% of that workforce. We did 204 firefighters out of 410 firefighters. That's 49.8%. So the first week, we nearly inoculated half of the fire department. We did 208 police officers out of a complement of 488, which is 42.6% of the Worcester Police Department. My hope is that with the appointments next week, we're going to see those numbers climb significantly. Of course, the goal of the herd immunity is 70 to 80 plus percent. My goal is 100%. My goal is to get every single person in this community convinced of the safety of the vaccine and the efficacy of the vaccine and the importance to themselves, to their family, and to the community to get that vaccine. So when it's your time to step up and get the vaccine, we're going to do everything we can to educate and urge folks to take advantage of this really important breakthrough with these vaccines. Along that lines, we're going to be reaching out to some of our media partners, asking if they would be willing to work with us on hosting in different platforms town hall meetings, whether they be live on the radio or on television or on the social media platforms of some of the print and online media outlets, so that we can have Dr. Hirsch, folks from UMass, Dr. Castile, and others talk about how important it is to get the vaccine, what was all of the background and the research that went in to ensuring, and the trials that went into ensuring the safety of the vaccine, answer people's questions, and try to educate our community about why, when it's their time, they should fully take advantage of this. So these press conferences are one way to get it out, but we also want to try to offer opportunities to really answer people's questions and get the experts talking to folks about that. So we'll be reaching out to our media partners, asking for their help in doing that. With that, I'm going to turn it over to Dr. Hirsch. Thank you.
Thank you, Mr. Manager, and thank you, Mayor Petty. I think the city manager kind of caught the fever that we all have had about we're finally on offense and we're punching back after so many months of kind of being back on our heels in the defensive posture. And that's really been the tale of this week. And I got to tell you, it was so rewarding to see all of the hard work that Karen Clark and Mike Shanley, Megan Gomes, and Josh Martunis, and Ari Winograd, all of the folks in the emergency management and our own emergency preparedness section of the Department of Public Health we've been talking about this in a kind of a virtual way since April, and to see it all kind of come together in the last week was just an amazingly rewarding thing. We had a medical student who was going around doing satisfaction surveys on the folks that came through, and the response was wonderful. Everybody, I don't think there was, maybe out of the 754 people, there were maybe 3 that offered up anything but a glowing report, and the 3 were mostly like positive criticism, like, could you make a bigger arrow in the parking lot, that kind of thing. So it's gone very well. The training that we were able to do on Saturday with the medical students actually got us now up to a total of 350 medical students and 250 graduate nursing students. So we have 600 medical personnel in that student mode from UMass that we can call upon. And we got a lot of great volunteers from the Worcester District Medical Society and from the Worcester Medical Reserve Corps to help us fill up those volunteer slots. And as the city manager alluded to, we wanted to kind of walk before we ran. So we kind of were a little bit cautious about how much we cracked the whip on, churning out vaccinations. And you may ask, like, well, why are we doing like 40% here if we could do more? That was a deliberate thing, because working with Chief Lavoie and Chief Sargent, we didn't want to send everybody to get the vaccination and find out that everybody was getting a reaction on the same day, and suddenly we don't have anybody to staff all of the vital functions that our first responders have to do. So, we're doing in kind of shifts, and then I think that's going to work out really great, because so far there haven't been any reactions. The feedback has been really, this Moderna vaccine gives you a little bit of soreness in the arm, and maybe a little bit of a warmth there or redness there, but we haven't had any of the severe allergic reactions that have been reported. And the second dose, which some of our med students and residents and providers at UMass are already getting, makes you a little tired, it seems like. But it's one of those things that if you didn't know why you were tired, you just say, well, it's because it's Blur's Day and I'm tired, at UMass, they've given out over 10,500 vaccinations. At St. Vincent's, 5,000, and it's been just humming along. St. Vincent's has been kind enough to offer now to vaccinate the personnel at the Edward M. Kennedy Center as well as the Family Health Center, which is going to be a tremendous help since that staff is so forward-facing. And, we're starting to add different pods of people that still qualify in this first responder mode in phase 1. So court officers are going to start being vaccinated as well because of their vital role in keeping things calm at the courthouse. It's been a very rewarding thing. I think the vaccinators have been thrilled. I think the people that are getting the vaccine have been thrilled. And based on Mayor Joe and my tour with the governor, I agree with him. I think that they were very impressed with our capabilities of setting one of these up. And there is a plan in the works that the state is going to set up some kind of a super vaccine site. And they're using our model in some ways as a way of doing this. So that's really very rewarding to hear. We don't know where this site's going to be, and we certainly want to work with them. But certainly, as we get to the phase 2, where we broaden out to a much wider swath. So phase 1 is first responders. It's also home health aides, visiting nurses, congregant communities like city manager mentioned, like homeless shelters, sober houses, other group living situations. Also in that first phase are people that are in the category where they can't really easily isolate when they are home, and the home health aides that are coming to get their vaccinations, they'll help us identify some of these people. Then the next phase, phase 2, is going to be all the folks 75 and older, folks 65 and older with 2 comorbidities, meaning 2 diseases like diabetes and heart disease, or chronic pulmonary disease, and one other thing. And then teachers in the K through 12 range, the essential workers that keep factories and big box stores and retail outlets going. And that's a much bigger group. So I'm hoping by that time, maybe the state will have this super site up so that we can work together to make sure that we get all these needles in arms. And then phase 3 is going to be general distribution, and we already know that CVS and Walgreens are very committed to be a big part of that. They've already had a federal contract to go to the long-term care facilities, and they've been doing that brilliantly so that the essential workers there and the residents in those facilities will be protected, and hopefully will avoid the kind of outbreaks that we had in the long-term care facilities in the spring surge. So I think all of that news is really great, and I'm very proud of the med students, the nursing students, all the volunteers that we've had. They've just done an amazing job for us. Now on the bad news side, we still are surging. I think that the city manager is possibly correct that we might be in a plateauing phase. I think we need a couple more points on the curve to tell that, but we're still essentially averaging 200 cases a day, and that's too many. And many of those cases, again, people are coming in testing positive, saying, I don't know how I got it. I've been following all the 3 W's. I've been doing everything that everyone has advised. How am I getting it? And we think the answer is that it's just a more transmissible kind of a virus right now, and there's not much that we can do to reassure people that they're not going to get it. The only other thing they can do is really try to keep in their bubble and not let others in their bubble and not go visit others in another bubble. That's the best protection you can have, particularly if you have those comorbidities that I mentioned: heart disease, diabetes, cancer survivor, lung disease. These are the kind of things that should make you try to avoid getting this. And in general, as we have talked about in the past, there's more and more evidence of people that have gotten this virus, very mild cases of it, that have come back with kind of a lingering illness that we don't want to expose people to if they don't have to. So the ticket out is definitely vaccination. And in the meantime, I think there's still going to be this bumpy few months. We don't know if getting the vaccination keeps you from being a silent spreader. You might not get sick yourself if you got exposed after you get the vaccine, but you might still be able to spread this. There are tests going on to show whether that's true, and we're waiting to see some of those results. We're also starting a trial here in Worcester of inoculating 12 to 17-year-olds, which is going to be very exciting because the transmissibility seems to be very similar in that age group as it does in adults. And if we can get that group approved to get vaccinations, that would make coming back to in-person schooling that much easier. That's the other big group in phase 2 that I have to mention is teachers. Teachers are really going to be in the forefront of phase 2. So I think things are moving very fast. Our team is meeting at least once a day, sometimes twice a day, to react to new things that are coming down the pike. We get new instructions from the Mass DPH and Governor Baker all the time about who's eligible for the vaccine, and we're answering lots and lots of phone calls about when can we get it. And I think that enthusiasm about trying to get it is very encouraging, and I think we'll get to that 70 to 75% number that the governor has asked for. 100%, you're being pretty strict. But I would love to get 100% for Worcester, but I think if any community could get there, we could get there. So I'm hoping that you help us get the word out when we need to get the next group in. We're doing tons of town halls. I'm going to do one tonight with Councilman Russell and the mayor, and we did one with the ecumenical community yesterday. And everybody's been very receptive. There's not a lot. I'm not detecting a lot of second guessing about this. I think people know this is our ticket out of this really deep hole that we got dug into with, 380 million deaths and 380,000 deaths and 23 million cases in the United States. So we are 4% of the world's population, but we have 25% of the world's cases, and that should never have gone down this way. So this is our ticket out. So, thanks. Any questions?
I just thought this might be either for Dr. Hirsch or Ed, depending. Just curious, I've heard out in the community, they're just wondering, when they'll know when one phase is over, the next is going to begin. Is that going to be coming from the state? Is that going to be local? Do we know, is there a delineation there?
Well, I think we can signal to the state when we think that we're done with the assignments for phase one. And so far what they've promised us is, you tell us that you're done, we'll get you vaccine for the next phase. So it was estimated that phase two wouldn't start till the beginning of February. I think that we're on track to maybe be a little bit faster than that, but that's how it's going to roll. It's like when we know that we've checked all the boxes of the different populations that are in the individual phases, we signal to Mass DPH we're ready, and they seem to be thinking that they'll be ready too. The governor said, I think as Mayor Petty alluded to, he only gets like 48 hours notice when he's getting new vaccine in, but I suspect that's going to change with the new vaccine team that's on board with the new regime.
Yeah, and I guess just following up on that issue in particular, I've been seeing a lot of stories, statewide kind of analysis of municipalities saying that they feel like here we've heard, we're giving as many vaccinations as we can get in stock. We're giving them. They're out the door. Is there do you feel like you guys could be doing more? Do you feel like that you're waiting on the state, or?
Well, we have the capability of giving a lot more than we've given, but I wasn't particularly unhappy that we started the way we did. We haven't had any wasting on any given day. We've been able to keep up with the demand, and I think now that we've kind of seen how the mechanism works, I think we can stress it a little bit more.
And then just final question, either for you or for the manager. As far as in the next phase, determining when we talk about essential workers, in the spring when that was first sort of established, it was for a little bit of time a working document. And is that going to be something that's going to be, as far as vaccinations go, determined locally, or is that going to be guidance from the state or the CDC? Do we know that yet? Is that being worked out?
It really is a guidance from the state, but there's a dialogue that goes on. So we, as well as other communities, ask about different categories of folks. To give you a great example, court officers are now included in this kind of first responder phase. So as these kind of subsets of folks kind of rise up and say, hey, do we fit into this category or another category, the state is making determinations because there's so many subsets of folks. Do parking enforcement folks fit into that? Do probation officers, parole officers, you could almost go endlessly. And so the state is trying to make calls on these different kind of subcategories of folks. Yes, you go in this phase. No, you wait for that phase. And there is some negotiation back and forth with the state. And I do just want to reinforce what Dr. Hirsch said, because he was exactly right. The goal is to expand this funnel as quickly as humanly possible. So to fill up, not do 3 days a week, to do 5 days a week, to do 6 days a week, to get the super site going so that when we do call for 75 and above and folks with 2 or more comorbidities, that category of folks in the city of Worcester are the tens of thousands. And so we need to have that super site as well as expanded capacity at our site. So it's all about, getting folks trained, getting the logistics, getting the registration process, and then expanding that funnel to the maximum level possible so that we can just take each wave of folks that come through, do it very efficiently and effectively, because to me, every day, every arm that we get vaccinated and add more capacity is just one more brick in the wall of protection against this virus. So we're very deliberate on that.
Dr. Hirsch, this question's for you. It seems like from what I'm hearing is that essentially Worcester is only limited by the amount of vaccine that we get from the state. Seems like everything you're talking about being scalable and all of that, is that a quick transition? So if you were to get an influx of vaccine, could that transformation happen, very quickly? Or, would it take some time? I think the idea being having those army of vaccinators and stuff, you're creating that bench for when that inevitably happens, because once we get to those later phases, clearly you're going to have a larger pool. But are you creating this a scalable model right now, and is that going to be ready to go as soon as possible?
I think it will, Ben. As you can see when you were up there on Tuesday, it was one of those things that as much as we were hoping that the volunteers would come prepared, they knew the system in and out just from just watching a PowerPoint presentation that was sent to their addresses, their email addresses in advance. They're so ready and primed and interested, and they have varying levels of involvement in the medical system, and they're super capable. So I think we can expand. We do have plans in place to consider other kind of options like drive-through venues, and we've talked to Quinsigamond College about that. So I can see that, even without the super site that the state's going to set up, that we may vary the kind of location and, double our capacity that way.
And very quickly, I just wanted to hit on, it was weird. I was up at the vaccination site at the senior center, and this is weird to say, but for the first time in maybe a year, it felt optimistic. People felt positive and felt like things were going the right direction. Will you just speak to the mood there and how it actually feels optimistic and people are very excited about the role of the vaccine?
Ben, it was really palpable. We all felt like this was a result of a tremendous amount of work, and here it had come to fruition, and we were doing it in a way that people were leaving smiling. They were coming in smiling. You can't always see the smiles under the masks, but the eyes were dancing. We were very happy with that. There's a famous journalist who railed against tenement slums in New York City named Jacob Riis. And one of his quotes that I love is that, look at the stonecutter hammering away at his stone. On the 101st blow, the stone cracked. But we all know it wasn't from that blow, it was from the 100 that went before. And I think that's what we all felt like. We've been working at this, and here it was. Finally, it happened, and everybody seemed to be very, very up about it.
All right, thank you very much.
Sure.
In terms of vaccine registrations for the city employees that are eligible, how have you seen registration numbers compare as the weeks have kind of gone on? I guess the week has gone on. Is the number similar? Are they, are the numbers increasing in terms of registrations? Are they slowing down? How are you seeing registrations go?
I think, we got a big burst the first day. Folks were anxious to to sign up, and we had big numbers there. But if you look at it, we're close to 50% with the fire department and just a little lower with the police department. I haven't looked at the registrations for the 3 days next week, but I know the chiefs and even the unions and others have been pushing their membership, talking about the importance of getting the vaccine. So I really expect that hopefully we'll be close to those 70-75% numbers after next week's vaccines. And then we'll keep working at it and keep trying to convince folks to get those numbers higher. But I'm very pleased after the first week to get that level of coverage, because from a management point of view, if you think about it, when I come out, and I've talked since March, any given week we might have 24 firefighters who are out, or we have 20 or 30 police officers who are out. That really starts to get nerve-wracking in terms of, do we have sufficient coverage for the public safety needs of the community? Hopefully, those numbers are going to dwindle to next to nothing as people get, the first, the second shot, and then our public safety, our forward-looking departments are going to be protected against this. And that really goes to not only the public health safety of the community, but the overall safety of the community.
And when you look at the number of cases, just kind of doing the math, it's about 175 new cases a day, about 5 deaths per day. Could you add some context into where those numbers kind of compare to? Are we at the highest we've seen? Are we back to April? Where do the current numbers kind of play out compared to the overall since the start of the pandemic?
This is still just about the highest daily averages that we saw, still higher than the ones we saw in the spring. If they recede back into the 120 range, then the spring numbers will eclipse us again. So we're not there yet, but we're hoping we will get there by the end of the month. That's why I think it was great for a lot of the colleges and, of course, the superintendent of schools for Worcester Public Schools to kind of give us a little break and reduce the likelihood that students were going to get exposed in this time where we're still seeing these big numbers. And now I think when this starts to recede, it'll be that much better for the school systems to adjust and be able to protect us and not flood the system. Our medical system, as you heard from City Manager Augustus, has close to 400 healthcare workers out between the two systems and the two family health centers. So we're really stretched right now.
Is that everyone?